Wow. There's actually nothing good about that surgery. I mean, there's always a chance for improvement. Like I said, I do a lot of revisions from all over the country.
Hey everyone, I'm going to be completely vulnerable with you for just a minute. I've been crying for a few days because I absolutely hate my results, thinking maybe I shouldn't have done this. I'll just show you. So this is, I told you I had the Fleur which is the vertical, and then the horizontal. But I'm like, what is all of this? Like, why? Yes, it looks better, but golly, who pays and goes through all this pain to come out with this? But anyway, so I can't tell you if I would do it again just yet. Hopefully, this is a lot of swelling, but right now, I absolutely hate it.
Wow. There's actually nothing good about that surgery. Even the Fleur, which I have really never used, and that's actually for people who've lost maybe 300 pounds. There's usually better ways to get the extra skin out, even if it means a little more laxity than this vertical scar, because that kind of defeats the purpose of having a cosmetic surgery. And even that closure, the vertical scar looks like it was closed with skin staples or something like that. I mean, it's just irregular, and she has these track marks across, and that kind of inner tube, I want to call it, around her waist that's above her scar, that all the whatever exercise and stuff is not going to help that. Basically, they pulled the skin down, but they didn't kind of undermine the skin up here to bring all that down with the skin they removed. And so that's going to stay there. I mean, it may improve a little bit with the swelling, but it's going to stay there. Probably try to do some liposuction there to get that down. But you know, and in the scar below, that just looks like it was really sewn together, you know, closed really quickly. And she didn't turn to the side, but my guess is her muscles aren't very tight either by looking at how this was closed. I mean, there's always a chance for improvement. Like I said, I do a lot of revisions from all over the country. That would be completely redoing the abdominoplasty. You know, undermining, taking that extra skin out again, opening the scars, probably in a good sense, because the scars will probably be a lot much better, you know, and then redoing that Fleur scar. Again, that's one of the reasons why I stay away from that, because of that midline scar. It's just, you can't hide it. In the past, I've actually done stuff for people who've lost a lot of weight. Instead of that one in the midline, I've actually brought scars up the side a little bit to take it out that way so that the whole front abdomen is still without scars. But again, since she already had that scar, you can improve on it. You're not going to make it perfect, but you can improve it probably by about 80%.